All right, if you're gearing up for the NCLEX, you know that mental health questions can feel like the absolute toughest part of the exam. They're just so nuanced. They really test your judgment and the stakes are incredibly high. But what if the key wasn't about memorizing more facts, but about learning to think differently? Let's dive into how you can master that way of thinking.
And see, that right there is the entire game. The NCLEX isn't testing if you can be a psychologist, it's testing if you're going to be a safe, effective nurse. It's all about clinical judgment, and that's the crucial shift in thinking we are going to explore right now.
So what you're about to see is a little peek behind the curtain, an exclusive look inside the exam coach's methodology. We're going to show you exactly how we take these really complex mental health topics and turn them into clear, actionable frameworks designed for one thing, helping you crush the NCLEX.
So let's get real. Why are these questions so tricky? Well, it's because they hit on some very specific and very common weak spots for test takers. Let's break down exactly where people tend to get stuck. Does any of this sound familiar? I mean, you're staring at a question, the clock is ticking, and you're trying to figure out the difference between two really similar disorders. Or worse, you're given 4 nursing actions that all seem correct, and you have to pick the most correct one. This is exactly where points are lost, and it's precisely the problem we're here to solve.
So the solution isn't just more memorization, it's about having a better system. Our framework gives you a repeatable process for thinking through these high-stakes scenarios, so you are never, ever starting from scratch.
This is literally how we turn chaos into clarity. Instead of just a long list of disconnected facts, our framework organizes everything into a logical flow. Think of it like a mental roadmap that guides your thinking from assessment all the way to intervention, every single time. So, let's put it into practice. Okay, first up, anxiety. So your patient reports constant worry, and it's so bad it's messing with their sleep. The NCLEX asks, what do you do first? Now, your mind might be racing through a dozen different possibilities, but our framework is designed to simplify that choice. And here's that framework in action. First, you recognize the cues of escalating anxiety. You see that narrow focus, the restlessness. That recognition immediately makes your priority crystal clear: safety. Before you do anything else, you provide a calm environment, you stay with the client, and you use simple, clear communication. You stabilize the situation first.
Okay, now let's apply this to a totally different challenge: OCD. Your client's compulsive hand washing is actually causing physical harm. So how do you prioritize here? Do you try to stop the behavior, or do you address the damaged skin? It's tricky, right?
Again, we just apply the framework. Step 1. Recognize the signs. The obsession is leading to a compulsion that's messing with their life. Step 2. Prioritize safety. And here's the really crucial point for OCD. You've got to meet their basic needs and, this is important, you do not interrupt the compulsion unless it is immediately life-threatening. The priority is safety and building trust, not confrontation. Okay, now the stakes get even higher. Your patient with a depressive disorder tells you they feel hopeless and are having suicidal thoughts. This is a massive red flag. What is your absolute #1 immediate priority? The framework makes the answer undeniable. You recognize these signs not just as symptoms of depression, but as indicators of immediate, life-threatening risk. Therefore, you prioritize safety above all else. This isn't about therapeutic communication or long-term planning yet. It's about one-on-one supervision and securing the environment, period.
And for our final example, we're going to face the most acute scenario of all: a patient with schizophrenia who is experiencing command hallucinations, voices telling them to cause harm. Where do you even begin with that?
We apply the framework one last time. You recognize the key signs, the hallucinations, the impaired reality, the agitation. This immediately tells you that the priority is, you guessed it, safety. You monitor closely for those command hallucinations, you reduce stimuli to de-escalate, and you ensure a safe environment by maintaining personal space. Are you starting to see the pattern here?
All right, let's zoom out for a second. Across 4 very, very different conditions, we used the exact same thought process. We moved from recognizing the symptoms to taking prioritized, safety-focused action. It all boils down to this simple 3-step process. Step 1. Recognize the critical cues. Step 2. Prioritize the most immediate life-threatening risk. And Step 3. Act with the intervention that directly addresses that risk. This is the very core of the exam coach's method.
And that is the power of having a system. It just cuts through all the noise. It gives you a reliable tool for making fast, safe, and correct decisions when you are under the pressure of that NCLEX clock.
So what does all this really mean for your NCLEX prep? Well, it means shifting your focus from just knowing a bunch of facts to truly mastering clinical judgment.
Seriously, let this be your guiding principle for the entire NCLEX. Our framework is built completely around this idea. We train you to consistently identify and choose the safest, most timely action, because on this exam, that's what gets you the points.
This is our promise to you. We go way beyond just telling you about these disorders. We actively train your clinical judgment, the exact skill the NCLEX is designed to measure. We build your confidence in prioritization, monitoring, and crisis intervention.
Look, this has just been a small glimpse into how we approach mental health. The complete, in-depth framework covering all the critical topics you need to know is waiting for you inside the Exam Coaches platform.